COVID-19, it's now forever a part of our lexicon and a pervasive part of our history as humans and specifically as Americans. A pandemic the likes of which hardly anyone currently on Earth has ever seen. But what does it all mean as we approach the end of 2020? How will it continue to affect you, me, and all of us here in Nebraska as we move forward? Over the next 60 minutes, we'll take your questions to our area medical experts, elected officials, school leaders, and health departments to see where things stand today as an apparent light at the end of the tunnel in the form of a vaccine making its way to the Cornhusker State with Christmas just days away. And we'll ask them to separate fact from fiction as coronavirus conspiracy theories pop up across the internet. Our town hall discussion, COVID-19, the path forward, begins now. Good evening. Thanks for joining us tonight for the special town hall event sponsored by USAVE Pharmacy. And what a time it's been, right? COVID-19 throwing your family, your business, school into a bit of a tailspin. We have so many questions. What about the vaccine? Should I get it? Are hospitals really that strained? And what about our schools? We have a lot of panelists to get to tonight. Let's introduce them. On the healthcare front, we've got Michele Beaver from South Heartland District, Jeremy ESCHLIMAN from Two Rivers, Teresa Anderson, Central District Health Department, Mike Schneiders, CEO from Good Sam in Kearney, Ed Hannon, CEO of St. Francis in Grand Island, Bill Calhoun's the CEO of Kearney Regional Medical Center. We also have a couple medical doctors, Dr. David Cantrell from Kearney and Dr. Brady Beecham of Lexington. Representing city government, Mayor Stan CLOUSE of Kearney is with us, as is the Hastings Mayor, Corey Stute, and Grand Island City Council President Mike Pollock. And from the school contingent, the superintendents are with us as well. TAWANA Grover from Grand Island, Jeff Schneider of Hastings, and Kent Edwards of Kearney Public Schools. Thank you each one. And now let's bring in Colleen. She's playing a big role for this show as well. Colleen.
Good evening, Seth. We want to hear your questions at home and make this town hall as interactive as possible. This is your chance to watch along and let us know what questions you want answered. I'll be monitoring Facebook and Twitter for comments throughout the entire town hall, and we'll try to get to them as many as we can. We want to help your voice be heard. So let's get right to it. Seth, back to you.
Colleen, great. We'll get back to you later on in the show. Thanks for being with us tonight. Our first panelists join us now from the medical field. We've already met them. Let's get right to the questions. And we're going to begin with Dr. David Cantrell, a longtime physician from Kearney. David, you've got this first one. Did you get the vaccine, A, and B, are you confident in it? Go ahead.
First, I'll answer the second question first because that's the easiest one. I have complete confidence in this vaccine, having done some background research on it. And really, before I received the vaccine or the option to get the vaccine, I really wanted to know the science behind it because it is a new technology. And the more I read and the more I learned about this particular emerging technology, the more excited I was to really get it all done. So I decided back in July when the opportunity arose to enroll in the vaccine trial being put on by the Moderna company. I was really excited when I found that there were 3 places in Nebraska where this would be studied, where I'd have an option to go. Grand Island was the closest, so I went there. And of course, it's a placebo-controlled double-blind study, so half the people get placebo, half the people get vaccine. I really didn't have any expectation one way or the other. I knew it was a 50-50 opportunity. The first shot I got, I had a mild reaction in terms of just soreness of my arm, which you're going to get with just about anything that you inject into your arm. Even if it's just saline, you're probably going to have a sore arm. So in the couple of weeks after that, I really didn't know one way or the other. The second shot was given 4 weeks later, and I got it late in the day. That next morning when I woke up, I didn't feel very good. I had kind of some body aches, some malaise. I had a little bit of I didn't have a fever, but I had some chills. It just felt crummy throughout the day. And the worse I felt, the more excited I was, because that type of reaction was reasonable assurance to me that I got the actual vaccine. Now, I still don't know if I got the vaccine or not, but the reaction that I had tells me that I probably did. Now, Moderna is unblinding their study, or at least giving the option of unblinding their study sometime in the next couple of weeks. I received an email from them indicating that, and they're going to let those who got the vaccine know and those who didn't get the vaccine know, and give them the option of getting the active vaccine. But the Pfizer vaccine is very similar. The technology is very similar. The science behind it is rock solid. It's new. It's cutting edge technology. It's certainly new in that sense, but the development of this vaccine and the technology that this vaccine occurred over several years. It wasn't an overnight kind of thing. We just were fortunate to have this technology available at exactly the right time, in a sense, in history, to be able to apply it to this pandemic. So again, in short, I'm completely behind the vaccines. A number of my coworkers have now received the Pfizer vaccine at work, and I couldn't be more excited for them.
Doc, thank you. Dr. Beecham is from Lexington. Let's bring you in. Same question regarding your confidence in this vaccine. Dr. Beecham, go ahead.
I feel strongly that it's important that this vaccine is available. I feel strongly that it's a good vaccine. We know it's effective from the clinical trials. And we also have seen from the clinical trials that the number of side effects experienced were pretty low. And what we'd really like to know is how safe is this vaccine 10 years from now? But we don't have that data right now. And so for me personally, and for my patients, I am recommending that we move forward with the vaccine. The health department has already started giving vaccine to first responders. And when it's my turn, I'm going to roll up my sleeve and encourage my patients to do the same thing.
You're going to encourage them to do the same. Okay, thank you, Doc. Michael Schneiders, Good Sam CEO here in Kearney, joins us. Statewide hospitalizations, Michael, have gone down. What's the current strain look like in CHI facilities? And talk about capacity, Michael, as well, while we've got you.
Well, our numbers have been decreasing, Seth. Here at Good Samaritan, this morning we had 24 COVID patients. We had 44, 45 back on the 18th or 19th of November. That was the high for this spike. And across our system, across the state, our numbers have reflected the same thing. The numbers are coming down. I think this morning, Bergen Mercy in Omaha was like 52 patients, and they had 86 or 88 at their high. So numbers are coming down, and we're thankful for that. I don't think anybody should assume we're out of the woods yet. I think everything we hear on TV in terms of the vaccinations there is going to take a while for all of us to get it. And in the meantime, even if those who have got the vaccine, and we have folks here working in the hospital have gotten the vaccine, you need to continue to wear your mask, social distance, all the things that we've been practicing for more months than we'd like to.
Yeah.
So we're optimistic, and as the physicians both said, we believe in the science and we trust the science. And I too, I would roll my sleeve up today if I was in that tier, but I'm not in that tier. Physicians and nurses are coming in first, rightfully so.
Sure, sure. Ed Hannon, let's have you come on in now, and thanks for being with us. Ed, tell us first off how things are going at St. Francis there in Grand Island. Then I want to hit you with this one as well, part two, is there enough PPE on site at your facility and others at CHI?
So I'll start with that. Yeah, absolutely. There's enough personal protection equipment for all of the caregivers at our hospital. We've been very fortunate that the supply chains for us since the very beginning have been pretty adequate. And so our staff have not had any issues at all getting masks, getting face protection, the disposable gowns, all of the hand sanitizer, all of the equipment, the ventilators, the disposable equipment that we use for patients. All of that has been in great supply for us. We're really blessed to have that here in Nebraska. As Mike Schneiders said, is the numbers may be coming down a little bit. We're still not out of the woods. Our volumes at St. Francis mimic much of what Kearney has there. is we're about half of where we were 2 weeks ago. We're about a third of where we were at our peak volumes back over a month ago. And so good indications that we're going in the right directions. The work that's been happening is just remarkable to bring every treatment that we could possibly bring to Nebraska. We're bringing it to the communities to do our part to either prevent it or treat it and take care of the patients as they come in.
Moving right along, this has gone on for months, it really has, and there have been deaths. What's the morale like with nurses and staff for this? Let's go to Bill Calhoun, and Bill is the Kearney Regional Medical Center CEO. What's the morale like over there at KRMC? You've just been, these nurses, these doctors like Cantrell, like Beach, they've dealt with a lot, Bill.
Yes, morale is about as good as one might expect after going through a pandemic for the past 8+ months. We've been masking routinely within our hospital since April. We've restricted visitor access, and today we had 13 COVID positive patients in our hospital. We continue to see people with respiratory conditions coming through our respiratory clinic. And it's created a strain for our folks, not only in terms of work, extending the number of hours they're working with their active schedules, but also not having sufficient staffing oftentimes to address the capacity issues that we faced. So we've had to bring in travelers from outside the Kearney and the state of Nebraska, frankly, and we're all competing for that same labor across the United States. So it's created a challenge for our nurses. And I think the thing from my perspective that's most burdensome about this situation has been mostly the grief-stricken families that we face to have come into the facility who don't have the ability to visit their family members for long periods of time. And then certainly people that end up on a ventilator and those folks that end up passing as a result of the condition. That's really hard also on our physicians, nurses, and other staff in the hospital.
Very difficult, I'm sure. Jeremy ESCHLIMAN is with Two Rivers. And Jeremy, let's bring you in. Several communities have implemented mask mandates. Do you think the decline that the CEOs are talking about in hospitalizations, Jeremy, has a lot to do with that or anything to do with that?
That's a great question, Seth. That, quite frankly, it's too early to tell. We know the science behind mask and mask policies is really solid science. And we're really just trying to overall change the curve of compliance with wearing a mask. And we know that's very effective when both people in close proximity wear a mask for long durations of time. But what'll really be interesting to find out as we look back in hindsight 6 months, a year from now, we'll be able to answer that more fully. But right now it's really impossible to tell. But we are trending in the right direction and we're really excited about that. We're really proud of our communities. Our communities have really done the right things at this point to be able to let our numbers come down and hospitalizations come down.
Let's move to the vaccine. We're going to bring in Michele Beaver now, and Michele is also a public health expert. Michele, there are concerns that vaccine has been rushed to production and because it's gone so fast. And how can we know that this thing is safe? It's like one of the docs said, we'd like to see 10 years down the road, but how can we know really that it's indeed safe?
So people are concerned about it being rushed, but really the vaccine safety trials have used a lot of folks. And one of the things that's different here is that we were doing parallel processes where we're studying the vaccine safety and doing the trials with thousands and thousands of people. And at the same time, the companies were ramping up production of the vaccine so that once it was had finished the safety trials and had been approved, we'd be ready to distribute right away. And a usual process would be you'd go through the vaccine safety trials and have the vaccine approved, and then you'd start production. So they were banking on the fact that the vaccine safety trials would go well, and then they'd be ready to get it out right away to folks that need it.
Teresa Anderson, also a health director, Central District Health Director. Teresa joining us now. Where and when can we get the vaccine locally? So it's being distributed, rightfully so, to healthcare workers first. But maybe months down the line, it could be distributed to folks like you and me. What's the distribution line look like in your mind, Teresa?
the state has set up a priority list. So we go through the tiers. All of our local health departments that are present tonight received some vaccine in addition to what the hospitals received. That vaccine is intended for emergency medical response workers so that we can get those folks vaccinated. And so we're working our way through the tiers. Next week, we expect to see a fair amount of vaccine coming in, at which time we're going to identify and focus on the healthcare providers who are outside of the hospital and the folks that are working in their clinics. So we'll work for those healthcare providers and get them going. And then in addition to that, long-term cares will be receiving vaccine through another mechanism. And so they'll be able to vaccinate the long-term care facilities. And we continue on down the chain, looking at who are the people that are most susceptible and most at risk for the COVID virus. And as we work our way through that, we'll find that eventually our number will come up and we'll be able to get the vaccine, each and every one of us.
Michael Schneiders, let's bring you in at this point. Will hospitals require their staffers to get the vaccine, Michael? Could this be a requirement, and should they require them?
No, it's an option for our staff, Seth. In terms of should you require it, I've read quite a bit in terms of businesses are considering it, and I read an article this week in legally they probably could, but it's an option for our staff. But I would tell you that the staff that have received it in the last couple of days here, they're very optimistic about it. They're hopeful. They're doctors and nurses. They know the science. They believe in the science. So we will not be requiring it.
Sure. Bill, what about you over at KRMC, Bill Calhoun?
Much like Mike and the folks over at CHI, we did a little investigative legwork on our behalf as well. And we've discovered that legally we have the right as an employer to mandate or require the vaccine. However, many of the other health systems across the state, as well as us, have decided to make it optional to our staff. And then CDC continues to recommend the required masking. So we'll continue our safety procedures within our organization until such time as we go through the process, both with vaccine as well as getting past this surge in the pandemic.
Dr. Cantrell, there are always questions when something new comes out. There are reports that 4 people, in fact, who took the vaccine came down with Bell's palsy. Do these reports concern you?
No, I mean, 4 people out of, if this occurred in the trials, which I think is what you're referring to, there were, between the 2 mRNA vaccines that are coming out or are already out, there were 30,000 people who received the active vaccine. So Bell's palsy is not, first of all, it's not an uncommon condition itself. So you would expect among 30,000 people that you might randomly have a number of people come down with Bell's palsy. But even if it were related to the vaccine, that's a relatively small number. Bell's palsy is generally reversible over time. So that's that's not at all a concern, certainly on my part.
Okay. Doc, thanks. And let's move on to the poll question. Will you be getting the COVID-19 vaccine? Go to our Twitter page, NTV News, check out that tweet, and then log on, let us know. Colleen, what do you have for us? You're watching this. Do we have other questions from our viewers that are weighing in?
Yeah, we've got lots of questions for the doctors about the vaccine. I have 5 questions I'd like to get to, so we'll go as quickly as possible, starting with Dr. Cantrell. The question, will the double dose of vaccine give lifetime protection, or will we have to take it year after year like the flu vaccine?
Well, good question. The answer is we don't really know. It's certainly unlikely that it will be lifetime protection. And I just want to clarify one thing. The double dose doesn't mean it's twice as much as they thought someone might need. Many vaccines are given in split doses over the course of time because that regimen provides for the most effective development of immunity. So it's a common way to administer vaccines. So the 2 shots together is the total dose. How long the immunity lasts, we simply don't know. We know that antibodies remain at reasonably good levels for at least months, probably longer than that. And then there are other aspects of the immune system T cells that also are activated when you get a vaccine that are less measurable than antibody levels that also provide a certain amount of immunity or are integral in the immune response. So the answer is we don't know how long it will last, but that's why the studies aren't going to end as soon as the vaccines are made available. The studies themselves will continue, and even after people in the studies know whether they got the vaccine or the placebo, et cetera, they're going to continue studying these subjects to determine how long they maintain antibody levels and what effect it might have on other aspects of your health. So I will be going back to Grand Island in February for my next visit, and I'm sure they'll draw another 8 bottles of blood from my arm, which they've done each of the times that I've been there. But that's a small sacrifice for what really is a wonderful thing.
My next question is for Dr. Beacham. If you have had COVID-19, do you still need to get the vaccine?
It is recommended that everybody get the vaccine. CDC is not making a lot of carve-outs about people that are not recommended to get the vaccine. However, there's some groups that we might suggest waiting a little bit. It seems that people who have had COVID and gotten the antibody infusion maybe ought to wait 90 days before they get vaccinated. So there are some circumstances under which evidence may build that it's worth waiting, but my thought is that many people are going to be eligible for this vaccine, and people should, if you have a concern, talk to your provider. But I think there's going to be a lot of people eligible for this vaccine and a lot of people that'll benefit.
Dr. Cantrell, was the vaccine intended to eradicate the virus so you don't get it at all, or just lessen the effects if you do get it? Do we know?
Well, the intent was to develop a way to prevent as many people as possible from developing symptomatic COVID-19 infection. The data is overwhelmingly positive in that regard. The vaccines both are 95% effective. It's unlikely these 2 vaccines or any of the other vaccines that come along anytime soon will completely eradicate the virus. That's unrealistic to think, because there's a number of people obviously who won't get the vaccine. And it's a very different organism. It has a way of spreading very easily among people. And I'm confident that we'll be living with it for at least a number of years.
Okay, I have one real quick question that should be answered pretty quickly, Dr. Beacham. Who's paying for the vaccine? Medicare, out of pocket for the patients? How's that work?
My understanding, and I could be wrong on this, is that the federal government has made a commitment to try to make this low cost or free for many Americans. If somebody knows differently, please chime in. But, our goal with public health is to try to vaccinate as many people as possible to protect us all. And so both receiving a shot is something to protect yourself and also to help others. And so that's one reason that there is, I think, a government component to try to encourage as many people as possible to have access.
Thank you so much, Seth. I'll send it back to you. And if anybody has any questions they'd like answered, I'm looking at the comment section right now.
Super duper. Thank you, Colleen. Plenty of workload for government officials over the last several months. Hastings Mayor Corey Stute, Kearney's Mayor Stan CLOUSE, and the Grand Island City Council Chief Mike Pollock join us now. And a good evening to you, fellas. Corey, let's start with you. Is the mask mandate the toughest issue to come up to you while you've been in office there in Hastings? Is that the toughest one?
It certainly has elicited the most negative response from citizens out there, I would say. Was it the toughest decision? No. Back in April, we were expecting there to be a stress on our healthcare systems, and we were really ready for that at that point. That didn't really come to fruition. So when we started looking at the data last month, at the beginning of last month of November, you could really see that it was starting to strain the healthcare system. It was starting to strain the hospitals. Our first responders were being hit very hard. In fact, since November 1st, we've had 78 of our employees out, and 15 of those were first responders. So while it was very difficult, and I don't think anyone was excited to have to look at a mask policy, we really did feel it was necessary to make sure that our hospitals weren't overwhelmed and our healthcare workers weren't overwhelmed. Our first responders have been out running calls. They were trying to cover shifts as people were out, whether they were in quarantine or whether whether they had it themselves or whether a family member had it. So,
Sure.
was it a difficult decision? Absolutely, but it was fairly easy when you looked at the actual data that was behind that in our healthcare system.
Stan, Klaus, you've been the mayor in Kearney a long time. Same question to you. Is this the toughest one that you've faced, the mask mandate?
I think as far as community-wide, it's one of the tougher ones. And certainly we've had some issues where it was a local, maybe an area dispute, and you get very passionate. But I liken this to having one group on one shoulder telling you one thing and providing you facts and figures, and the other group on the other side, other shoulder, whispering in your ear, giving you all kinds of facts and figures. And both sides are very passionate about, do masks work, do they not work? And quite honestly, the amount of information and the cards and letters, and they weren't all Christmas cards and letters that we got, it was overwhelming. And people were very passionate. And it really come down to a couple key issues: infringement on their freedoms, which is important to Americans, and then there were quite a few that drawing the line between church and state. And can we tell the churches that you have to require wearing masks and put that infringement upon them? But I would say that as I was sitting there weighing that, and we have people saying, why'd it take you so long? And other people say, well, you should wait a little bit longer. It's just a constant barrage of good arguments on both sides. But what really turned the tide for me was when I spent some time up at the hospital, and I had some good friends that were up there working and just seeing what they were going through. So at some point in time, when you're bombarded with facts and figures on both ways, you have to pick a lane and determine what do you really truly believe in. And my vote for it was, in affirmative, our council was unanimous in doing it, but it was really to reduce the stress on our friends and neighbors and relatives that are working in those healthcare facilities, which we have two in Kearney, and protecting our nursing homes, those types of things. And Dr. Messbarger, the way he weighed in on a lot of issues that he was seeing as our city physician. So
Sure.
As far as the tough decision, community-wide, absolutely, still divisive. We've had, I think, a dozen, maybe 12, 13 calls to our Kearney Police Department. We've not issued any citations. It's been more of an educational process that our police department goes out and visits with those folks, but it still is controversial.
But no citations there in Kearney just yet. Let's bring in Mike from Grand Island, a community that was walloped hard with COVID early on in this deal. How's the mask mandate working, since we're talking about that in Grand Island, Mike?
It's working pretty well. I've noticed when we've been to the store and stuff that there's more and more people wearing a mask. You might see one or two that's not, but I think the people are responding to it pretty well.
Yeah.
I know that we put it in effect just mainly to save our small businesses and stuff. We couldn't afford another shutdown in Grand Island. We've lost a lot of businesses now.
Sure. Corey, let's bring you back in. Mike said it. These small businesses have been hit very hard. They've possibly been really struggling, and here's local government slapping on a mandate of sorts. And is that fair to a struggling restaurant to have to worry about that as well?
Our business community has really responded well. We had a good partnership with the Chamber of Commerce and the Downtown Center Association here in Hastings to work with businesses to help them understand what this means. We were quickly approaching the governor's red value there in things, which would have reduced capacities even further in restaurants, and which would have shut down bars. So really, this was something that we wanted to do to make sure that we were able to keep businesses open. So is it fair? I know that it's difficult for them, but we'd much rather have them open with masks than closed. And we certainly want them around after the pandemic is over, because really the small businesses are the backbones of all of our communities. And we want to make sure that they're here when this is all said and done.
Stan, I want to talk to you about that as well. There are those out there, and we've all heard it, that say, stay out of my business. It's government overreach, and I don't like it. And what are your thoughts on that? They have a point. They're struggling businesses over the last 10 months, Stan, and and getting some mandates and things like that. Go ahead.
Yeah, well, actually, some of them that maybe might have complained or argued the loudest were the ones that were doing really, really well. And so they felt that this mandate was just going to shut them down. And I've talked to both restaurants and bars and retail businesses. And when you really look at what the mandate or the policy says, it's not that hard to comply. And I've been in to some of the sports bars. You go in and sit down, you find your place in the corner. If it's crowded, you don't go there. There's a lot of personal choices that people really have to make. And I think that's one of the reasons why, as a council in Kearney, is we felt strongly that we didn't want to have government overreach. And we felt that was an infringement. But I did talk to several different bars and restaurants and small businesses, and now that they're into it, they're working through it. And I think a lot of people are finding it's just not that hard to comply. And again, when I talked about people on both sides of the issues, we had people that saying, I'm not going to shop in Kearney, I'm going to shop elsewhere because people just aren't taking this serious and they're not wearing masks. And then so you have the mask policy, then you get cards and letters from folks that saying, I'm never shopping in Kearney again until that mask policy goes away. So, you really try to weigh that. Did they really lose business? Did they gain business? I don't know. It's kind of an individual assessment on behalf of our businesses. But sure. I know that it is a challenge, and the whole thing is a challenge. It's just not as many people going and out, whether you have a mask policy or not. There are a lot of people just staying home and just not doing the things that they used to do until this thing blows over. And I think that's more of an impact on them than a mask policy, quite frankly.
Well, you bring up a good point, and I want to turn back to Corey on this when there are budgetary concerns. And Corey, how will a loss in sales tax receipts, because people, like Stan was saying, have stayed at home, so sales tax receipts have to have gone down, I would think, in 2020 in the city of Hastings.
The city of Hastings has been fairly lucky so far when it comes to sales tax receipts. When we're looking at those, we've been mostly flat. We've been down maybe less than 5% at the most since the beginning of the pandemic. We've worked very hard here to promote our local businesses and our small businesses. When we first entered into this back in March and April, we really focused on trying to create excitement behind takeout and delivery and those sorts of things with our restaurants. So, our sales tax receipts have been relatively steady. I think for the most part, the other two cities are really about in the same place. And, we're pretty lucky to be in that kind of a position. So we've planned for, a larger decrease in sales tax revenue, but at the end of the day, so far, it just hasn't come to fruition. And we're really focused on trying to get people to get out and shop local. And that's really what we've been focusing on since Shop Small Saturday here in Hastings.
Mike Pollock is the city council president over there. Mike, do you know, as far as extended absences for city workers in Grand Island who have been quarantined, or maybe they themselves have gotten sick, has that been an issue in the city of Grand Island? Extended absences for city workers, is that a problem?
It's been a problem. There's been a lot more overtime than usual. We've had first responders out, so some of the people have had to work double shifts or overtime. Most of the department directors have got their people scattered out now instead of in one place. They've got part of the utility crew here and part there, and that way they can at least keep part of them safe. That's not the answer to everything, but it has worked pretty well.
Guys, thanks so much on the government side. Let's move this thing along. Our town hall continues with the education piece. Let's bring in the superintendents now. Jeff Schneider from Hastings, Dr. Tawana Grover of Grand Island, and Dr. Ken Edwards of Kearney. Thanks so much for being with us, and a good evening to you. The risk dial has been high, but schools have stayed open this semester. Jeff, let's start with you in Hastings. How have you kept the Tigers there in school?
Well, I think we've had a lot of support from our community, a lot of help by Dr. Bever. I've worked with her a great deal this semester. But I think the key was that, we had a lot of these things in place in August. Our students were wearing masks in August. We're talking about our cities now. We're 4 months into that. And so I think those protocols We have hand washing protocols, hand sanitizing protocols. We're using completely different procedures for lunch to spread kids out. So while the risk dials rose in our communities, at least for Hastings, I don't want to speak for anybody else, but our school spread was not necessarily what we saw in our community. We had an instance of a school spread. We had to shut one of our buildings down for a few days, but so we certainly aren't without it. I don't want to mislead anybody, but I think because of the strict approach we all took at the beginning, it's helped us stay open through the tough times.
Sure. You're watching a town hall sponsored by USAVE Pharmacies, and we thank USAVE for their sponsorship of this. Dr. Grover, let's bring you in now. Dr. TAWANA Grover of Grand Island. What do you credit TAWANA for staying open that first semester? So impressive with such a large school district.
Absolutely, Seth, here in Grand Island Public Schools, there was a lot of early on planning that went into this. And I think one of the keys here in Grand Island was establishing our pandemic team. We have about 25 folks on our team, and we continue to meet on a daily basis. We also established a board crisis committee and working alongside our Central District Health Department, along with our doctors. They've been with us every step of the way. We've definitely tried to stay abreast of the changes as well as the requirements. And I think a lot of credit goes to our teachers for understanding the safety protocols and making sure that we stay consistent with those protocols across our district. The students as well as the teachers, they were just so excited to be back in school. And I think they prioritized that themselves, that we kind of switched our philosophy from worrying about how many cases it's going to take for us to shut the schools down to really focusing on what is it going to take for us to stay open. So making sure that we are just aware of any type of concerns that we may have, and we just immediately talk about daily issues, and we try to correct any concerns right away. And so it's just been so positive because we know the best place for our students are in school. They're being fed, they have the social emotional supports that they need, and they're continuing their learning. And so our mission is always in front of us, and our graduate profile continues to be our North Star. And I definitely have to thank our parents as well as our community. I was out at a campus this week talking with our nurses, and they were just so fortunate of all the parents are doing to look for the symptoms at home, to call and ask questions. And so really being in this with us together, and just how the community has stepped up to do what's necessary to help keep our schools open. And so, we didn't know where we would be starting out in August, but it's December and we are making it through the first semester, and we have our mind on making it all the way until May.
Good for you. All right. Kent Edwards is superintendent in Kearney. Kent, how has learning been affected through the pandemic? Online in the spring, but in class now with some different circumstances now. What's the learning environment, and how's it been affected at KPS? What do you think?
Well, I would echo many of the things that Jeff and TAWANA said. I think it really came down to, appropriate planning. Developing a blueprint. This is unprecedented. Obviously, there were some challenges that we were facing, but much like my colleagues, there were some uniqueness to it that really had to be addressed. And maybe some of the things that we did, not knowing at the time, have really addressed the learning. And that's what our goal was. Our goal was really to have in-person teaching and learning. Obviously, for health and safety reasons, there were situations, medical conditions where that may not have been prudent by some. So we've been able to have some remote options available to that. And I would echo again what Dr. Grover said and Mr. Schneider, in that I think the key to our success was just the willingness on the part of the students. I'm so proud of them, imagining their whole world changed. But I think for many of us, be it parents or those of us in school systems, it was a great reset. It was a self-reflective time for us just to place the value of teaching, of learning, of being in schools. The roles we played in our community were amplified. TAWANA mentioned some of those, making sure that we were feeding our families, that there wasn't no neglect, some of the medical conditions that that we cared for our students. At the end of the day, I think that teaching and learning is going well. The compliance is there. But I think even as a community, we now value even more so than ever before just what education brings to the community. And I would go back and say too, many of the people on this panel, respective of our communities, we could not have done this or been this effective without their coordination, their collaboration, their expertise. So much of the things that we did those in concert with the Kearney Health Board, Mr. ESCHLIMAN and Two Rivers. They've been fantastic partners of ours. But I'd also like to give a shout out very early on in this process. Dr. Grover, Mr. Snyder, myself, we collaborated. And while we had some uniqueness, it really afforded us the opportunity to share ideas. And I think the result speaks for itself. We continue to be in session. Our kids and our teachers arrive every day. The protocols seemingly work. We've learned more. I would guess many of the panelists and their respective expertise have learned things too since the beginning. So it's going well, thanks.
Okay, sounds good, Kent. Jeff, what are you hearing? Let's turn to the teacher side of this now. What are you hearing from instructors? Are they pushing to go online? Are they fearful, or are they encouraged with what they're seeing in the classroom? What are you seeing?
Well, first of all, I couldn't be more proud of our instructors than I am today. The large majority of them are so thrilled to have their students in person and feel like it is so necessary for so many reasons. Many have been mentioned, but many of the basic needs, food service, medical attention, mental health. And so our teachers have just been outstanding. Are they worn out from having to cover from obviously we have a larger number of absences from adults and students than we normally would because of, quarantines. But so they're a little worn out, and they're about to get a much needed break here over the holidays, but they have been phenomenal, and they have been so supportive along the way, and are thrilled to be teaching in person.
Good, good. Extracurricular activities present some challenges. Dr. Grover, let's bring you in for this one. If students can be in class all day together, why can't they go watch other students play sports? What are your thoughts?
So, Steph, we are in the middle of a pandemic, and I think one of the things that we've had to think about as educators is really just prioritizing our students being on site for learning and ensuring that they can continue in their activities, be it sports and fine arts, and just the way the students have been so resilient. And they've had to reimagine some of those activities in different ways. But I think our kids are role models for us. They don't want to go back to the way that things were back in March when they didn't have anything, where they weren't on site and they weren't able to participate. Now they are participating. They're getting a chance to do what they love. And we are in the kids' business. And so we're just grateful that they can take part in those activities. And I think that's what they want to see. And they are finding their ways to keep each other encouraged through this process, and just making sure that they have the things that they love to come to school for, learning as well as their extracurricular activities.
Sure, sure. Kent, let's bring you back in for this. This seems like a fair question, doesn't it, Kent? I mean, they're in school together all day long. Could they wear a mask and sit in the rowdy section there at Kearney Public Schools? I mean, that seems like, why wouldn't that work?
Yeah, I think Dr. Grover hit it. I mean, it's just really a manner of establishing some priorities and taking those safety and health protocols, implementing them. And I think it really comes down to a control mechanism. Classroom settings are something that we believe that we have a higher degree of control over. And when you get into indoor arenas or in activities, any type of venue, what is our ability to control that level of protocol and safety? And so we even prioritize there, meaning that the spectators, the participants, and the parents. And again, this was unprecedented. So I think most schools have really looked at it. They self-reflect how effective it was, what changes they could make. And we're all different in the types of venues that we're able to offer. Each of the 3 school systems. So it really depends upon not only what is the sport, what is the venue, the time of year, but most importantly, are you able to control that environment so that you don't endanger others and or possibly put at risk of a potential spread that wouldn't allow you to have school.
Indeed. Guys, thank you. Education folks, stand by. Let's check back in with Colleen. And what do you have for us, Colleen? Are the questions rolling in?
A comment we just got from Lori Peterson. Teachers are thrilled to have students in our classrooms. This is where they are learning best. I certainly feel safe in my classroom. So on that note, the question, I'm going to give it to Jeff Schneider. Are we starting to see test scores to know if learning has been affected this year?
You know, we've had that question quite a bit lately, and it's interesting to me. We really don't have a comparable situation yet. If you think about this, all of our schools went through a drastic change last March. We're working on this week completing the first semester of this year. So when we get this first semester completed, we can kind of compare some things to a year ago and start to see some of those answers, but I don't think we're quite there yet.
Okay. Another question for Ed Harmon asking, Ed, is it safe to go to the hospital and still make appointments?
Yeah, it's a great question. So the answer is very simple. Yes, hospitals are safe. We've got great protocols to keep our hospitals safe, to keep the staff safe, and as every patient, every visitor comes in, to give them the PPE that they need and keep them in a safe environment. We segregate out to our respiratory clinics, isolation rooms, those patients that may have respiratory conditions, to keep them in a separate area. But what's more important is we don't want patients to delay their care. Patients need to go to their physicians, need to go to hospitals and catch any type of disease process, illness, injury early on. And so strongly encourage people, think about it. What was it like before the pandemic? If you would have gone to your doctor, gone to your hospital, you need to go now.
All right. Ed, thank you so much. You would have thought a doctor had written your name down on my sheet of paper because I could not read it. I apologize, Ed, for getting your last name wrong. Seth, back to you.
Colleen, thanks so much. It's our town hall sponsored by USAVE Pharmacy. Fact or fiction time now, and everyone on your toes for these. We're going to throw out some fact or fiction for you, and you can answer them if you choose. Dr. Beecham, we'll start with you. If you've had COVID, if I've had COVID, let's put it that way in first person. If I've had COVID, I no longer need to wear a mask or even be concerned with it. Fact or fiction? What say you, Doctor?
Well, I'd say probably fiction in terms of how you ought to behave. Continuing to wear masks and social distance is a good idea for all of us. But we do know that sometimes the biology of these viruses, if you've been infected, you have at least some protection. The problem is with COVID, we don't know exactly how much protection you have. So rather than running the experiment in your own body, wear your mask until you get a vaccine. My patients who have had COVID say that it is no fun. And I'll say, I've been seeing this myself in clinics since spring, very, very strictly masking, and I don't think that I've got it. I really think that there is strong evidence. We've heard the leaders from the schools tell us about this. We've heard the hospitals say how safe clinics are. And really, masking is a good idea. And so even if you've had it or you think you've had it, it's a good idea to keep wearing your mask until you're pretty clear that you've been vaccinated.
Dr. Beecham, thank you. It's just like the flu. Is it just like the flu? You hear that. Probably for some folks, maybe it is. And for that, let's bring in Dr. Cantrell. I've heard that from folks that have had it. Doc, do you want to weigh in on this one?
Yeah, I'm happy to answer this question because that's among the more ridiculous things that I've heard about this virus. I've been practicing in pulmonary disease for almost 30 years now, and I've never seen a pathogen that destroys particularly the lung the way that this organism does. I've seen bad influenza, but there is nothing that's come along that so consistently causes overt destruction of the lung tissue. And not only the degree, the severity of the injury to the lungs, but the length of time it takes to recover is beyond any other organism that I've dealt with. The numbers of people who are so severely affected goes way beyond anything I've seen in any of the influenza epidemics. So there's no comparison at all between those organisms.
Doctor, thank you. Teresa Anderson, let's bring in someone from public health in here. Join us for this one. Only the elderly or those with a pre-existing condition are at risk of having severe problems. What are your thoughts, fact or fiction, on this one? Because some younger people have said they've tested positive and they've rolled through it.
Yes, and thank you. We know that younger folks, especially our school-age children, are more likely to have a very mild illness, mild to moderate. So we don't see them hospitalized nearly as often. But what we also know, as Dr. Cantrell pointed out, is that some individuals in their 30 to 65 age range are getting severely ill, and they're having long-term issues with it, even though they recover from the hospitalization with the lung issues and with all of the accompanying problems there. Once they get home, they get into this syndrome called long hauler syndrome, where for a month, and we don't know how long this might go on, they have recurring symptoms of that illness, which might be shortness of breath, requiring oxygen again. It might require that they just bed rest for a while. We have athletes who are used to going and doing everything that anyone could imagine, who are sidelined completely with the virus. So to say that it's only a disease of the elderly is totally false. It may affect elderly worse because they have underlying health conditions that cause them to be more ill. But anyone, and this is the voodoo, I was going to say magic, it's not really magic of the virus, is that it creates issues in your body that are unforeseen and maybe long term. As we go along, we'll know more about that.
Sure. Jeremy, I want to ask you about masks a little bit. There have been a lot said about that, and can it cause a carbon dioxide poisoning? That's one question that's been out there. Can masks cause that?
Sure, Seth. And we've answered multitudes of questions around that specifically. Is it safe for someone to wear a mask? We always refer people to individual healthcare providers, but by and far, the vast majority of research that's out there shows that masks are very healthy for the vast majority of our population to wear. There's very few situations where there is more risk in wearing a mask than actually contracting the disease itself. So there's actually much more risk in that, if you're someone that has respiratory type symptoms together. And, a little bit, we've talked before about this, Seth, quite a bit, is the research behind the mask and face mask. There's a plethora of studies, now over 45 peer-reviewed articles that supports mask and efficacy of masks preventing COVID-19. And we have to look no farther than to our south in Kansas. There's a great study that came out a couple weeks ago that really showed the difference between counties that required masks, counties that didn't require masks, and significant differences in health outcomes. And those that, and I'll cut to the chase, Seth, the counties that required masks had significantly less prevalence of disease than those that did not. And so that's why we're so proud of our local community leaders that have taken really the courageous efforts to push for more masking requirements. And we're continuing to support communities across all central Nebraska to do so. We really see, even though the trend is down, there is significant risk that still continues, even as we're beginning vaccinations. Vaccinations will continue for well into the next several months. So there is significant risk that still continues.
Jeremy, thank you. Is there a particular piece of misinformation that's out there you'd like to quickly rebuff? And for that, we're going to keep our answers a little tighter because I want to bounce around a little bit. But maybe let's start with a community leader first. A particular piece of misinformation that you'd like to rebuff. Let's start with Stan. What do you think? I'm going to put you on the spot, Stan CLOUSE. What are you hearing that you'd like to weigh in on?
Well, I guess the one thing is has to deal primarily with the governor not doing a statewide, and I think my position on it is certainly he could do that, but as community leaders and school, we're always asking and wanting to make sure we have local control. So in this type of situation, that's exactly what we have is local control. So I support his decision to leave that up to our communities, and certainly most of the larger communities are doing it.
From a mayor who's taken local control here along with the city council. So Stan CLOUSE saying thumbs up on the governor on that decision. Let's go to the education front now. And Dr. Ken Edwards, is there anything that you'd like to weigh in on, or Dr. TAWANA Grover? Let's start with Ken Edwards. Is there anything you'd like to rebuff, Kent? What do you think? Anything out there that maybe is a little hokey you want to weigh in on there?
Oh, not really. I think more than anything, some of the things that's already been mentioned, those come forward with us too. I think one of the misnomers out there is that we are just operating independently and making these decisions as superintendents and school leaders. But as I said, I mean, that's done with such a great level of collaboration with, Two Rivers Public Health Department, Kearney Health Board. Dr. Messbarger was mentioned earlier tonight. We really do look at our data. We know that we are a subset of a larger county or public health department, but we really look at our data and study it, and we massage that on a minute by minute, day by day basis. And we would never, we put safety and the health of our students at the highest of levels, and we would never compromise our staff or our students.
It's a super tough job being a leader of a school district. You have our respect for sure, guys out there. I want to pivot here one quick minute as we're running out of time. Michele Beaver, I want to bring you in, Michele. We got Christmas right around the corner, and we all want to be together with our families, but we want to keep everybody safe too. What ideas would you have in public health to get together somehow and yet keep grandma and grandpa safe? What are your thoughts?
That's a great question, and everybody's thinking about how we're going to handle Christmas and the winter holidays coming up. And we sort of did some trials through Thanksgiving, and people tried some different types of Thanksgiving gatherings. And I think we need to take some inspiration from our community. We know that we have adaptability and resourcefulness and creativity, and some folks had mentioned at the schools of the resilience that we have of our students and our businesses, our churches, our families. I think we have lots of opportunities to try to do things a little bit differently than we have in the past, and make some new traditions. And we may not be able to do things just the same way that we have done them maybe for years, but we can make some new traditions out of this pandemic. We can do some virtual celebrations. I did that with my own family over Christmas that lives in different states, or over Thanksgiving that lived in different states. And we had a great time together, and we can do something like that, virtual gift exchanges and those types of things, to make some new traditions and enjoy gathering in new ways.
Good for you. Michele, thanks so much. Thanks to all our panelists as we're about out of time. We appreciate your leadership in the cities that you represent, Grand Island, Hastings, and Kearney. We've got everybody here. Thanks so much for being a part of the panel. And Colleen, we thank you as well over in Hastings there from your home, and continue to keep it going on Facebook and Twitter. By all means, log on to Twitter and weigh in on whether you'll take that shot or not. You can sure do that on @NTV News. That'll do it for us. Thanks so much for watching. We'll catch you next time, and keep it right here on NTV.